Many years ago, I injured my neck in a car accident. Having recently re-injured myself due to rollerblading and being completely comfortable with the process at the Bonati Spine Institute, I thought that I would show you what it's like to be a surgical guest with Bonati in Hudson, Florida. The Bonati Spine Institute encourages a family member or caregiver to go through the process of recovery with all their guests, so I brought my mom along. When we first arrive, we are immediately greeted by Paul, the patient and guest relations manager.
Hi, I'm Paul and welcome to the Bonati Spine Institute. We're going to get this show on the road.
He provides us with all the basic information we may need during our visit, including where to find the snack bar, clinic, OR, and imaging center. After this, Paul directs me to Kathy, the patient care coordinator. Paperwork is a daunting task for everyone, especially when you're in pain. Kathy helped me review my initial forms and to complete a survey about my symptoms and pain levels.
I'm going to ask you some questions about your daily activity.
Some of the questions that Kathy asks include, does the pain affect my daily activities like loading the dishwasher or sitting at a computer? Have my sleeping habits changed? Or do I have trouble walking or operating my car? Next, I had a quick visit with the in-house videographer.
How long have you had this condition, and how did this condition and its symptoms start? Was it more gradual, or was it the result of a specific incident?
During this short recording session, I described the issues that I'm experiencing. This testimonial acts as a living account of my condition before my procedures, providing a baseline and a chance to see myself before and after. Then it's off to the clinic for an overall assessment of my pain and symptoms.
Hello. Hi, welcome to the Bonati Institute. My name is Anne-Marie. All right. Did you get a registration packet to fill out? I did. Okay.
In the clinic, I meet with one of the registered nurses who conducts an in-depth physical examination.
So I'm feeling like in my neck here.
Okay.
And then it comes down this way into the arm.
Okay.
Down.
Anything into the fingers?
Yes.
Which ones?
Pinky and sometimes pointer.
Numbness, tingling, anything like that?
Both. When you hit your funny bone?
Yeah, so turning will kind of send a strip. Okay.
Yes.
And have you noticed any weakness with grip or anything?
A nurse practitioner joins me in the clinic to perform an exam and take as much time as needed to discuss the details of my case.
Okay, so push out. Push in. And then put your fingers like that. Push out. Okay, and put these two and squeeze. Squeeze.
Yeah.
Okay. Grip my hand. Squeeze. Squeeze. This is golden. Good. Like that.
Okay.
Hold it down.
Because it kind of, it pinches.
Many
stuff.
guests come to the Bonati Spine Institute with imagery, like x-rays and MRIs ready for the surgeons to review. However, it's determined that I needed updated imagery, so I head over to our on-site state-of-the-art imaging center, just a short walk across the parking lot. Once the images are taken, they are reviewed by our radiologist, Dr. Robert Dunn, and within minutes they're brought back to the clinic. Then a surgeon comes in to review my imagery and to conduct a further examination.
You can see the defect is here, and these bony structures from the back of the vertebra on the canal are very much tight. So we remove part of this structure here to give the proper space so it has a good motion of the spinal cord.
Seeing that surgery is the best option, a surgical plan is determined. After my surgery is scheduled, one of the medical assistants completes all the pre-surgery diagnostics, including blood work and an EKG. It's surgery day, and upon returning to the facility, I check in with Pryor, the operating room concierge. It isn't long until one of the registered nurses takes me to the pre-op area. Here they collect my vitals, verify my pain levels, review what will be operated on today.
So your left side is which side? I have to mark you?
Sure.
So I'm doing this.
here.
and have me sign off on my surgical paperwork. During this time, an anesthesiologist also visits and sets and starts the IV. After being prepped for surgery, I walk to the operating room with a member of our surgical team. After helping me onto the surgical table, the surgical staff makes sure I'm in position, taking additional x-rays to precisely pinpoint the targeted area. Shortly after the procedure begins, my mom is provided with the option to enter the OR, bringing both of us peace of mind.
I trust Dr. Bonati completely. It's very interesting to watch, I can say that.
On this occasion, she declined, knowing that I was receiving the best care possible. As we've mentioned many times on the show, the patented Bonati spine procedures are performed using conscious IV sedation. When I was first told I would be awake for my procedure, sure, I was nervous, but they explained to me that by doing this, everyone involved is sure that my pain being targeted is eliminated. While awake, I watch my own procedure on the monitor located on the floor underneath the surgical table and communicate directly with the anesthesiologist and the surgeons during my procedure. The surgeons ask me where and if I'm feeling pain and encourage me to say the area at this time. Today's targeted procedure is in my neck or cervical area of my spine. I am asked numerous times during the procedure if I can still feel the pain or tingling extending down my arm.
No pain on the shoulder.
At one point, the surgeons even asked me to try to recreate my pain by moving my neck and other areas of my body associated with my pain. If I still feel pain, the surgeon continues cleaning the area around the nerve. Once it's determined the pain is gone, they move on to finalizing the procedure by adding a drain and stitching the surgical area closed. After my surgery, I'm relocated to the post-op area where the Bonati staff monitors me while the remaining conscious IV sedation wears off. Medical assistants record my vitals while they're providing me with snacks and drinks, check on my current pain level, and assist me when I'm ready to stand and begin walking. Before being released to continue my recovery at home, I meet one more time with the surgeon who answers any additional questions I have. If I had a multi-level issue, this is when we would discuss the next area to be targeted. Once they release me, I return home. Local residents who live close by may do the same. However, out-of-town guests are encouraged to stay at a nearby hotel as there is a follow-up visit the next day. Even though I get to return home, I'm encouraged to take it easy and complete my walking therapy. The Bonati Spine Institute recommends I spend 40 minutes walking, as it encourages recovery. The evening of my surgery, a registered nurse follows up with me via the phone.
Good. Just calling to make sure that you're feeling better and that...
The morning after my surgery, I return to the facility for a post-op follow-up with my surgeon and clinical staff. They remove the drain at the surgical site and review with me instructions to follow during my recovery. Lastly, I meet one more time with the in-house videographer who conducts an exit interview.
Of 1 to 10, where would you say your pain is now?
They ask me how my pain levels and symptoms have changed, to describe my experience at the facility, and they provide me with more information about the opportunity to appear on American Medicine Today in the future.
Is American Medicine Today.
To share my story of recovery with other people who are looking for help. Throughout my recovery and even after, a member of the Bonati Spine Institute will make regular phone calls to check in on me and answer any questions that I may have. With a proudly reported 98.75% patient satisfaction rate, the Bonati Spine Institute strives to make sure that their guests are partners in their medical care and feel confident in their treatment. If you are suffering from chronic back or neck pain, our surgeons are here to review your case and let you know if you're a candidate for the exclusive patented Bonati Spine procedures.